Okay, so for our condition, we chose the bilateral vocal fold paralysis. This means that both vocal cords are paralyzed, and when both cords are paralyzed, they usually end up very close to each other, causing a dangerously narrow airway, and this can lead to serious trouble breathing, which may be life-threatening without treatment. This is caused by damage to the laryngeal nerves, which control the movement. There's many causes for this condition. Usually it's from scarring, through radiation therapy, intubation, burns, or inflammatory conditions, also post-surgical trauma, or neurological diseases like a stroke or MS. Also tumors and ALS can potentially lead to this condition. So it affects the muscular structures by making it unable to contract, and this prevents them from being tense. So they're fixed in a static position, and since the muscles cannot be activated, there's a lack of tensioning. It stays in this position. It can't open for breathing or close for speaking, and it's often fixed near the midline, so it has a significantly more narrow airway. If the folds are fixed more closed, the voice may be normal, but breathing is compromised still. If the folds are fixed more open in a lateral position, the airway may be clear, but the voice quality is still going to be very breathy, strained, or lost. The fundamental frequency is going to be lower and the pitch range is reduced. The vocal intensity is soft. They have a weak voice. Similar conditions would be the unilateral vocal fold paralysis, where only one fold is paralyzed, but they still have a breathy and weak voice, and it's typically less severe. Okay, it can be treated through voice therapy, temporary or permanent surgical procedures, or sometimes a combination of both. Surgical options include creating a tracheostomy for an alternative airway, or procedures that move the vocal folds apart or add bulk to them. This widens the airway and moves the vocal fold out of the way in order to improve breathing and function. Reinnervation is a more advanced technique where a different nerve is connected to the vocal cord to try and restore some function. And then finally, there's voice therapy, which can also be used to strengthen the vocal cords and improve breath control while waiting for a potential nerve recovery.